So apparently the New Yorker did a documentary. It's a short documentary called Rovina's Choice. It tells the story of what goes when aid goes. It's a film by Thomas Jennings and Annie Wong. So it was January, my final week in the outgoing administration. In a few days, Donald Trump would be inaugurated as president. I had come to the United States Agency for International Development in early 2022, leaving my surgery practice and public health research in Boston to lead the agency's global health efforts. Now I'd be returning to my previous life. I spent my last days at USAID in meetings with our civil and foreign service leaders, thanking them. Our work with my partner countries had helped to contain 21 outbreaks of deadly disease, sustain Ukraine's health system after Russia's invasion, combat HIV, tuberculosis, and polio, and reduce maternal and child deaths worldwide. On a budget of just $24 per American out of the $15,000 in taxes paid per person last year, they had saved lives at an almost unimaginable scale. An independent, peer-reviewed analysis in The Lancet estimated that USAID assistance had saved 92 million lives over 2 decades. Many of the leaders voiced trepidation about what the incoming administration might bring, but I struck a sanguine note. USAID, I pointed out, had more than 60 years of solid bipartisan backing. Trump had advanced significant parts of the agency's work in his first term. He had personally pledged to end HIV as a public health threat by 2030. The incoming Secretary of State, Marco Rubio, had been a vocal supporter of the Bureau. There would be isolated partisan skirmishes over diversity initiatives, abortion-related policies, and the like, but more than 95% of our Bureau's work had never been under contention. Clearly, I lacked imagination. Within hours of being sworn in, President Trump signed an executive order for a pause to all foreign assistance. Secretary Rubio sent a cable suspending every program outright. No program staff could be paid, no services could be delivered, medicines and food already on the shelves could not be used. No warning had been given to the governments that relied on them. It was immediately obvious that hundreds of thousands of people would die in the first year alone. But the administration did not reconsider. It escalated. Elon Musk exulted in swinging his chainsaw. Within weeks, and in defiance of legal mandates, he and Rubio purged USAID's staff, terminated more than 4/5 of its contracts, impounded its funds, and dismantled the agency. Neither Congress nor the Supreme Court did anything to stop it. We are now witnessing what the historian Richard Rhodes termed public man-made death, which, he observed, has been perhaps the most overlooked cause of mortality in the last century. Brooke Nichols, the Boston University epidemiologist and mathematical modeler, has maintained a respected tracker of current impact. The model is conservative, assuming, for example, that the State Department will fully sustain the programs that remain. As of November 5th, it's estimated that USAID's dismantling had already caused the deaths of 600,000 people, 2/3 of them children. Save the children, huh? The toll is appalling, and it will continue to grow, but these losses will be harder to see than those of war. For one, they unfold slowly. When HIV or tuberculosis goes untested, unprevented, or inadequately treated, months or years can pass before a person dies. The same is true for deaths from vaccine-preventable illnesses. Another difficulty is that the deaths are scattered. Suppose the sudden withdrawal of aid raises a country's under 5 death rate from 3% to 4%. That would be a 1/3 increase in deaths, but hard to appreciate simply by looking around. The administration, for its part, has denied causing widespread harm, even as it made the scale of its damage harder to measure, halting data monitoring and dismissing the inspectors general who might have documented it. This is common in cases of public man-made death. During Mao Zedong's disastrous Great Leap Forward from 1958 to 1961, the Chinese government released no accurate mortality data. Observers abroad understood that a hunger crisis was underway when China began importing grain. But the scale of the catastrophe was not known until the mid-1980s, when the first reliable census allowed historians to calculate that between 23 and 30 million people had died. A fuller accounting of the fallout from USAID's shutdown will probably have to await analysis of the United Nations 2025 mortality statistics, which likely won't appear until 2027. But there are other ways to glimpse the scale of the harm. With a documentary team that includes both American and local journalists, I've been following what has happened in Kenyan communities where USAID had been active. In an advanced HIV ward in Nairobi, in primary health care centers that had sharply reduced malaria, in a refugee camp, and elsewhere. We chose Kenya because I'd done a lot of work there during my tenure and because it's on a familiar path of development, like India, South Korea, and many Latin American countries that the U.S. assisted to advance from low-income recipients of aid to higher-income trade partners. Kenya had reached the lower rung of the middle-income status. The country had made dramatic leaps in health system capacity and life expectancy with the help of a mixture of projects. USAID supplied medicine, food, and staffing for some of the most desperate and vulnerable, while providing technical assistance and investment to accelerate the country's expertise in needs ranging from HIV control to primary care. I was especially worried about what would happen to the programs for childhood malnutrition, which during the past 2 decades had made extraordinary progress around the world. In place of a system that waited for emaciated children to reach distant hospital wards, often hours away, we had helped countries bring to the front line where they lived. A community health worker carrying a tape measure and a scale could detect danger early at home. A packet of peanut paste therapeutic food could reserve starvation for the vast majority of severely malnourished children. Hospitals became a backstop for complications and for the frailest of cases, while communities worked to strengthen local food sources. The method was simple, frequent, and close at hand. Measure the upper arm, check for swelling, provide supplemental nutrition, watch for infection or decline, return the next week. The results were dramatic. Mortality rates for severe malnutrition, once 20% or higher, fell below 5%. In Kenya, communities we worked with, including refugee camps, saw death rates drop to under 1%. The United States had played a central role in developing and manufacturing the formula for therapeutic supplements. USAID then had helped UNICEF, the World Food Program, local health systems, and other actors scale up the approach worldwide. Globally, under 5 child mortality fell by more than half since 2000, in major part owing to the advances in malnutrition treatment, which saved more than 1 million lives in 2023 alone. Still, most of the world's malnourished children lack access to these programs, but instead of trying to close that gap, we're washing our hands of it and reversing the gains. In Kakumu, a vast refugee camp near the South Sudan border, starting in spring, our documentary team followed clinicians and families inside the stabilization unit at Clinic 7, where the sickest children come. Because of the termination of U.S. support, the World Food Program supplies have been reduced to 40% of minimum needs. In case of acute malnutrition had surged, 2/3 of the clinic community health workers were laid off, hobbling the early detection system that once saved most children before they needed acute care. Clinic 7 is where we met Rovina Naboy, who had fled South Sudan with her family. In our short film, she reveals what it was like trying to keep her desperately ill daughter, Jane Sunday, alive in a system that has broken down. There are valid criticisms of USAID. It sometimes fostered dependency. It could be inefficient. Too much of its funding went to international institutions rather than to local ones. And its history includes episodes in which aid was bent to American military and political aims in Vietnam, Iraq, Afghanistan, and elsewhere. Yet no other agency of U.S. government has saved more lives per dollar. It helped billions of people out of poverty, and it showed how to deliver results for all of humanity, including Americans, through cooperation rather than coercion. The destruction of USAID does nothing to improve this work. Instead, we have public man-made death, and the cruelty and lethality will only grow as the administration expands its rollback of public health advances to the homeland. We cannot let the people affected, health workers like those of Clinic 7, families like Rovina Naboy's, go unseen, and we cannot let the consequences go unaccounted for. I agree. This is the fault of yes, Donald Trump, and yes, Elon Musk, and yes, Curtis Yarvin, and all those people who want to cut off USAID. It was such a small percentage of the budget. I mean, just like a 0.00 something percentile of the budget. It was not a big deal. It was no skin off anybody's ass. It just wasn't. And now hundreds of thousands of people have died, 2/3 of them children. How do you feel about that, America First, Save the Children motherfuckers? You should feel ashamed.